Good evening, everyone. Let me welcome all my viewers once again today on Beyond Sugar channel. We keep on connecting with you not only by posting information related to diabetes on a daily basis, but also we invite for you leading doctors from across the country who can talk to you as a friend and answer your questions. And we are doing this live program, which is going streamed live on Facebook and YouTube. And I'm your host, Sanjeev Mehra. I'm very glad to welcome today Dr. Jayashree Gopal from the city of Chennai. Ma'am, welcome to the program.
Yeah.
And today we have invited Dr. Jayashree to discuss about a topic on which we commonly get questions from you, and that is about low blood sugar levels, hypoglycemia. That how do we identify and how do we manage the low blood sugar levels? But before I start taking your questions, let me formally introduce ma'am. She is a leading endocrinologist from the city of Chennai. She is the founder and trustee of Diab Endo India Foundation, which has a motto of preserving health across generations. She has done her studies in internal medicine, endocrinology, and diabetes from US, and she is an American certification holder. And she has many awards as well as many accolades to her credit. So we know that we have an expert today with us who can talk about this subject, and we all can take a lot of guidance from her. So, ma'am, from here, I invite you, hand over the stage to you for your opening remarks and context on this topic, and then we'll proceed with the questions.
Thank you very much, Sanjeev, and it's a pleasure to be back here. And thank you to everyone who's joined. Uh, I think hyperglycemia or high blood sugars get so much press that we tend to neglect something that may be equally, if not more dangerous sometimes, which is a low sugar. And as we go through the talk, we'll talk about not only what causes low sugar, but also why, as doctors, we are worried about it. We know that low blood sugars are very unpleasant and that it takes time to recover from an episode of low sugar. But why, as doctors, are we worried about it is because it has certain uh, uh, effects upon various organs. We'll talk about that. I think a very common question that people have, one of the things that you were sharing earlier, Sanjeev, is what is a low sugar? Everybody, like I said, is very aware of high sugars, but people are not aware of what a low sugar is. And a low sugar is when the blood sugar is defined as a sugar below 70 milligram per dl. We know that high means it shouldn't go above, say, 140, 150, 160 at 2 hours after a meal. But a low is any blood sugar below 70, for the most part, is defined as a low sugar. And the reason why that number is so important, before we get further, let me talk about that. Everything in our body is maintained in a beautiful balance. So whether we take our heart rate, which is usually maintained between 60 to 100, not below 60, not above 100, or let's say your blood pressure level, which is maintained in around, say, 110, 120 by 70 to 80, not too high, not too low. Even your sodium level in the blood, again, it shouldn't be too high, too low. Everything in your body is in a balance. When we don't have diabetes, most of our blood sugars should be between around 70 to 140. Uh, the reason why it is important for the blood sugars to remain above 70 is mainly because the brain is dependent upon a continuous supply of glucose. The brain doesn't have any stored energy. The brain is just so busy working all the time. So all of the brain only has pretty much neurons. It doesn't have stores of glucose, unlike, say, our muscle or our liver or our kidney or other organs, which have some stores of glucose, which help it going, even if we are not going to eat for some time, even if we are facing sort of starvation. The brain is not like that. It needs the glucose supplied to it constantly, which is why the body does everything it can to maintain the blood sugars above 70 to 100. Even when the sugars start dropping a little bit, that is the reason why people start noticing symptoms of, a low sugar. There are various symptoms, but it's because the body is geared to making sure that the sugar doesn't drop below 70, mainly to protect the brain. So low blood sugar, I would say, is as important, if not more so in certain situations, to avoid as avoiding high sugars.
Okay, so I think that's very well said. And as Dr. Jashri mentioned, it's all about balance in everything inside the body. So even the blood sugar has to be in a good balance. Neither too high is good, and too low can be even more dangerous. And she has mentioned that 70 is that cutoff number because your brain needs constant fuel to run the body, take decisions, and that sugar comes, glucose comes as that important fluid. Now, ma'am, you mentioned this that this kind of blood sugar should be remaining. Now, is it only with people with diabetes then there can be episodes of low blood sugar, or people who don't have diabetes they also can face such issues?
So, uh, uh, usually it only happens in people with diabetes, particularly when they are on certain medications, like insulin or certain older medications that were used for diabetes that work by either making the body make more insulin or you're giving the insulin from outside. So these medicines will push the sugar down no matter what you've eaten or how much the sugar has gone up by earlier. So it tends to cause a low sugar, particularly if you haven't eaten. If a truly low sugar, dropping to say 50, 40 occurs outside the context of diabetes, then we start worrying about other problems. It could be something related to the pancreas. There could be like a nodule or a tumor sitting there making too much insulin inside your body. It could be related to people whose kidneys are failing. Like I said, the kidney is a big store of a glucose glycogen store. So when kidneys fail, sugars tend to drop easily, even outside the context of diabetes, and also liver failure. So these are sort of other situations apart from diabetes where people can face low blood sugars. Others are very rare hormonal problems. If the body is not making enough of a hormone called cortisol, we're all familiar with cortisol as a stress hormone, which comes from what's called the adrenal glands. If the body is not making enough of cortisol, sometimes you can experience low blood sugar. So that yes, there are situations where sugars can drop outside the context of diabetes, but I would say 98, 99% of the time when a person has a low sugar, it's because they have diabetes and they're on certain medications and they've not responded properly to the risk that the risk factors that cause the blood sugars to drop.
Okay. So largely, I think this is going to happen with people who have diabetes. So they need to be more cautious about it in 98% of the cases, as Dr. Jayashree said. But then, even if you don't have diabetes and you are among those rarest, and still you're constantly or blood sugar goes down, so there can be other larger issues in the body. Don't ignore it. Please do visit your doctor and take a medical advice that why and what's the reason behind that. Ma'am, moving forward now, we understand from you like what are the cutoff numbers and who can face it. But what are the generally the precipitating causes? Why would a low blood sugar, would happen in an individual to begin with?
So quite often it happens because there's a mismatch between the medicine that you've taken for to control the blood sugars. You've taken too much of it, or you've taken the correct amount, you've eaten the correct amount, you had more physical activity. So you worked out more. So you burnt up more glucose. So there is a mismatch between what the medicine you've taken, what you've eaten, and the physical activity that you've done. The commonest reason that we find in people who have low sugars in diabetes is a delayed meal. Invariably, the lunch gets delayed or the dinner gets delayed, or they are sick and they eat less than usual, but they continue to take the same amount of insulin. Uh, so either the amount of food they've eaten doesn't match up with what they normally eat. So the amount of insulin you've given pushes the sugar down too much, or the medicine that you've given pushes the sugar down too much. Or a very common scenario that I find, for example, people who are generally at home, let's say elderly people who are at home who don't go out very often. Certain days they go out for whatever their religious reason, they go to a temple or they go to a bank, particularly. That will be a day where they are more active than usual and they're outside and the meal timing gets delayed. Invariably, they'll have a low sugar at that point in time before lunch, because their lunch, which should usually be by 1 o'clock, gets delayed by half an hour to 1 hour. And the medicine that you've given in the morning is continuing to act and there is nothing coming in. So it just keeps pushing the sugar down. I mentioned earlier that some of the older medicines, insulin and a earlier class of medications called sulfonylureas, were the ones which generally cause the sugars to drop, irrespective of what we've eaten. The newer
Okay.
medicines we have now generally have much less risk, because I don't want people to get worried or scared about it. But the newer medicines have much less risk of causing a low sugar.
Okay, so there can essentially be various reasons. It can be because of certain medications. It can be because of you have taken the medicine, but you are not taking the meal, or it is overactivity as well. And as doctor said that you need to be careful about that. How common is this, ma'am? Does it incidence of how many times you get such patients who are coming to you with low blood sugar and complaining about that? Is it very common among people with diabetes?
It's thankfully becoming less common because, like I said, we have newer medicines now which work to cover the amount of food you're eating and to cover the amount of sugar rise. So they sort of match what's happening in your body a bit better, the newer medicines. However, uh, maybe about every day, I would say about 20% or one or two out of every 10 people with diabetes that I meet in a day would have had a low blood sugar. So I still think it's fairly common. Now, this is the people who tell me that they had a low sugar. I ask them and they say, oh, yeah, in the night I woke up, I was feeling hungry and I had something to eat. So sometimes you have to ask them to get it out. Uh, when we've started using continuous glucose monitors, the sensors that people wear, which checks the blood sugar every 5 minutes and all that, we realized that people were having low sugars much more often than we realized. It is estimated that people with type 1 diabetes who use insulin may have low sugars nearly 50% of the time. People with type 2 diabetes also may have low blood sugars, maybe 30 to 50% of the time, and they're not aware of it. They're not aware of it. So that is a even more dangerous condition called hypoglycemia unawareness. And before we go, I just thought this is such an important thing. I wanted to talk a little bit about it. Uh, there is, I mean, the low blood sugar, when it happens, once you've had an episode, you know what it feels like. It's very unpleasant. The typical symptoms are things like your heart beats faster, you feel hungry, you feel a bit sweaty, your behavior is altered a bit. Quite often, the spouse, the husband or the wife will come and say, oh, they were answering strangely when I spoke to them. They behaved in a strange manner. They wake up at night with bad dreams. That's because you're getting a low sugar in the night. Uh, but the typical symptoms are this palpitation, sweating, and excessive hunger. Typically, these symptoms start happening as your sugar starts dropping from 80 to 70 to 60. Okay. But people who have very low sugars to begin with, let's say you're maintaining your blood sugars under very tight control. We call it tight control. So the HbA1c is at 6.5 or 6.6. Your sugars are very well controlled. In that situation, they may not have symptoms of low sugar till it drops to around 50 or 40. So when it's going from 70 to 60, that's because the body's gotten used to it. Every day it goes from 70 to 65, comes back to 85. Next day it goes from 70 to 60, comes back to 85. So the body's gotten used to the low sugar. So it doesn't give you the warning symptoms. So the second question we ask, the first thing we ask is, do you get low sugars when people come? Do you ever have a low sugar? Second is, if we see a low sugar value either in their self-monitoring or in their sensor or in the lab value, we ask them, did you know that you had a low sugar that day? Did you have symptoms? Hypoglycemia unawareness is a dangerous condition because it doesn't give people enough time to react. When you know your sugar is dropping, you can go and eat something and get the sugars up. The treatment is relatively simple. But if you don't know, you might suddenly land up with either a seizure, or you may faint, or in a coma, or strange behavior. Other things happen which preclude you from responding to the low sugar. So hypoglycemia unawareness is a very dangerous condition.
Yeah, and that's exactly we are doing today, making people aware. One of the important objectives of doing this program today on this subject is that we are all aware about what are the causes of low blood sugar, what can be the symptoms of, how do you identify that you are going through a low blood sugar, and then if someone has it, then what should be done as well. So, so ma'am, the next step now, if you have talked about the symptoms as well. Now, what should be done now? Let's say there's a patient who is experiencing these symptoms. What should he do? And secondly, let's say if these symptoms are, let's say, create too difficult a situation, and if a patient is, let's say, losing consciousness, or he's just not in his right senses, then what is the role of the nearby, passerbys or someone in the family or in the office, what they should do? If you can help us for guide you with your guidance on this.
Yeah. So there is a very simple rule to remember. It's called the 15-15 rule. Immediately you're supposed to take, you start noticing symptoms of low sugar. First thing is, do not wait. Do not wait thinking, oh, my lunch is going to come here in 20 minutes. I'm going to have lunch, or I'm going to have something to eat in half an hour. I'll wait. Don't do that. If you feel your sugar is dropping, have something and then even check your sugar. Don't even wait to check your sugar. So if you feel like you're having a low sugar, respond to it, act on it. You're supposed to take 15 grams of carbohydrate. Then if need be, you check your sugar. Then wait for about 15 minutes and check your sugar again and make sure it is better than that first value. So 15 grams of carbohydrate is roughly about like three teaspoons of sugar or glucose. We generally recommend glucose because it gets the sugar, it's even absorbed through the mouth mucosa. So it enters your bloodstream even faster. Sugar, again, is a mixture of two. The table sugar I'm talking about, the white sugar that we commonly have in the house, is a mixture of two types of sugars, glucose and fructose. It takes a bit longer to get digested in the body. So glucose is the best initial option. Glucose or dextrose tablets they're called, but just glucose powder you can have and eat it immediately. Short of that, I mean, not everyone is going to have glucose in the house. Put 3 teaspoons of sugar in a glass of milk or water and immediately drink it up. Follow it up with something else, say a banana or a slice of bread, something else which is going to keep the sugar levels up for a bit longer. Now, this is for people who are aware of their senses and are able to act upon it. I think the other scenario that you mentioned, in a way, is a little bit more dangerous. What do relatives or spouses or passers-by do? Ideally, we need to give them glucose through the way. If they are somewhat conscious, you can try doing this. Put some sugar into their mouth or put some sugar into a glass of milk or water and get them to drink it. If they are completely unconscious, this is somewhat dangerous to do because you might land up putting the water or the milk into their lungs. They may not, if they're fainted, they won't swallow, it will go into the lungs and that can cause problems. They can choke on it. If they're completely unconscious, best is to call for an ambulance. They have to get to as soon as an ambulance comes, the paramedic will have an intravenous glucose and they will give it. It's also important for people who have repeated episodes of low sugar to have like a little card on them saying, I'm a diabetic. Let's say they are traveling somewhere where they're on a train. They're traveling with strangers. People don't know. Suppose they suddenly, you just slumped over and they don't know what is happening. The first thing they'll do is reach into your pocket to take out your purse to see who you are, try to call your name type of thing, some ID card. If they find a card which says, I'm a diabetic and, please, whatever, like, give me the glucose or give me some, help me, then they'll be able to get some help immediately on the train. So if you are capable, if you're conscious enough to look after yourself, have glucose immediately, wait for 15 minutes, check your sugar again, eat something else, and then tell your doctor about it when you meet your doctor. If the person is completely unconscious, you have to take them to the hospital. If the patient is semi-conscious, capable of responding, but in a very slow manner, try to get them to drink something. Once they get some glucose into them, they will wake up and they'll be more alert and oriented.
All right, I think that's very, very vital information which Dr. Jayashree has mentioned. And if you're just aware about these simple things, you can possibly save someone's life and help him in a big way. But as she mentioned, first thing I think that don't lose time. If you're experiencing some symptoms, warning signals, uh, don't wait that let me check first, or let me wait for my lunchtime. Immediately have something and then go for testing or the next steps. And secondly, very importantly, she also mentions that if you are traveling, or if you're going to carry something, some kind of a card with the identification mark, and possibly keep some glucose tablets or glucose sachets as well with you, so that in case of emergency you can consume it yourself. Ma'am, moving forward, what about, as you mentioned that identifying itself is an issue. So now we hear, especially, in elderly patients, someone is, sleeping and, he faces hypoglycemia. It can be deadly, the way you are explaining, it can really do a lot of damage. So in such a situation, nighttime hypoglycemia, how is that identified, first of all? And then, what are the possible ways to avoid or manage such a situation?
Yeah. So I also wanted to mention two other things, which, sorry, and in the middle of my trying to explain that. One is low blood sugar causes problems by activating what is called the adrenergic response in your body. The same adrenergic meaning the fight and flight response, the one that when you get scared and your heart rate goes up and your blood pressure goes up. So that same system gets activated when you have a low sugar. Uh, this sometimes is not good for your heart. So if you have repeated episodes of low sugar, it potentially leads to arrhythmias, irregular heartbeat, which is dangerous, and other types of neurological issues. It may sometimes cause a stroke. So these are the type of things that may happen with a very severe low sugar reaction. The other concept I want to talk about is something called relative hypoglycemia. I said when people's sugars are very low, when the HbA1c is near normal, they are more likely to get symptoms only when the sugars drop very low. The opposite concept. So people whose sugars are always running at 250 to 300 will start noticing low sugar like symptoms even when the sugars start coming to 150. That's because the body thinks the sugar is dropping and it activates this adrenergic response. So that's called relative hypoglycemia. The treatment for this relative hypoglycemia is to reassure, saying it's okay. It's okay if your sugars come to 150, 180, nothing will happen because we're going to be checking your sugars. It is not a dangerous sugar. When it starts going below 100 or 110, let us know. Then we can cut back on the medicines. But a person who's been used to a sugar of 250 or 300 for, say, 3-4 years together, when we try to tighten the control, they will start experiencing low sugar symptoms. So unfortunately, what happens is they say, no, I live with a high sugar because I'm getting low sugars even at 150. That's called relative hypoglycemia. The body will readjust. Once the sugars have been running in the normal range for some time, the body will readjust and learn how to respond appropriately to high and low sugars. Now, coming to your question about low blood sugars in the night, it is a very dangerous situation. It tends to happen more often in people with type 1 diabetes or people who have what is called autonomic neuropathy. So it's an affliction of the nerves, particularly of the nerves that control the breathing and the heart rate, the autonomic nervous system, sympathetic, parasympathetic nervous system. One of the symptoms is bad dreams. Another symptom is night sweats. So if people are constantly getting bad dreams, nightmares, people with diabetes on medicines, or if they are waking up drenched in sweat, in a situation where they really shouldn't be drenched in sweat, we start thinking about whether it's a low sugar. Nowadays, because we have sensors, it's easy for us to pick up low sugar reactions. Sensors can tell us. Sensors, however, are not very accurate. Sensors tend to always, people who've used a sensor will know it show one red line all through the night. It does not necessarily mean that they're having a severe low sugar reaction, but the only way to find out if a person is truly having a low sugar in the night is to check their sugar in the night. Sometimes before the days of sensors, we've had people tell them to wake up. We've told them, wake up at 12 and check your sugar, wake up at 3, check your sugar. In the hospitals, we have nurses check the sugar in the night if you're worried about low sugars. That's the only way. If it is not waking them up from sleep, the only way we can find out is either if they put a sensor or we check it on their finger and pick it up. And it can be dangerous because these low sugars in the night sometimes we think causes these problems with the heart and the brain. It can happen in the night. So that those are sort of not very safe situations.
Okay, so I think, as she mentioned, do sometimes, occasionally, or maybe is there any prescription, like any suggestion that how often someone should do a nighttime glucose check as well? Should one try a weekly
So
once or maybe fortnightly once?
I think particularly people on insulin or who are taking those particular medicines called sulfonylureas, people who are, say, about the age of 70, people who may be living by themselves or not having access to care. I think certain situations, I think it's important at least about twice a month to check a blood sugar when you go to bed at night. And a safe level to go to bed at night, depending on the type of medicine, this is not standard for everybody, but a safe level would be around, say, 150, 160. When you're going to bed at night, if you start noticing a blood sugar of below 100, maybe eat something else, have a banana before you go to bed, or a slice of bread and with a glass of milk, have something else before you go to sleep.
All right. So check yourself at that time as well, at least once in 15 days, so that you are aware that nothing is possibly going wrong. And in case you find in your family, your partner, your parents, someone in the family facing such symptoms which Dr. Jayashree mentioned, or maybe you're sweating or nightmares, immediately talk to your doctor, because maybe your doctor would be able to do some slight alterations to your medicine or meal timings, and then that will save you from a bigger problem later on. So it's important to identify. Ma'am, how about younger children, type 1 diabetic patients, people, children who are also taking insulin, and many a times, they are very, very young, not being able to, also tell a lot of things, or they will be school going. So, what's your advice for, such group of people as well?
So again, with the usage of sensors, it's become much easier for parents also to monitor their children. There are certain ways in which we can prevent low sugars. There are newer insulins. So children in general will have type 1 diabetes, invariably they'll be on insulin. But using a sensor to monitor the sugars, using certain types of insulins which don't cause a drop in the sugar, accepting higher values in children, we don't want a very tight sugar control. We want most of the sugars to be in a slightly higher range. We accept that in a young age, it's not going to cause much problems. It's okay if the sugars are running between 140 to 200, 220. In very young children, we accept higher values. So there are ways in which we ensure safety. Now, for type 1 diabetes, we recommend that parents have something called a glucagon pen. Glucagon pen is the opposite of insulin. Glucagon pen can be life-saving in the correct situation. It's a pre-filled pen with 1 ml of glucagon, 1 milligram of glucagon. This is particularly useful for people who are unconscious because of a low sugar, or for very young children who may not be able to immediately drink or eat or respond to thing to take the glucose. You have to just inject them, give them half an ml of that, and it will immediately boost up the sugar. So we recommend the availability of the glucagon pen. You have to sort of source it and keep it. But having a glucagon pen, particularly when you have a child with type 1 diabetes, can be life-saving. And even if you never use it, it's okay. It's not very expensive, but you can keep it for about a year or so, and then once the expiry date is over, just make sure you replace it.
Ma'am, especially for patients who are type 1, now there would be children school going as well. At times there is a taboo, or or parents just don't talk about it, that my child has diabetes. So isn't it a good idea to also inform the school, so that their teachers and the ecosystem is aware, so that they can also help the patient in the time of need? Any views you have on this? Since it's very, very sensitive.
No, very, very, very important. I think particularly pediatric endocrinologists are doing a lot of work on this all through the country. They are working with schools to sensitize them, to allow children, for example, because recently there was something in the news that a child was not allowed to take their insulin with them for the exam, something like that. So it's very, very important that parents have to inform their teachers. Let alone children, a lot of adults also. For example, in pregnancy, sometimes we tell them you have to take your insulin injections 3 or 4 times a day. People are very wary about using insulin in their place of work. They somehow still think it's some sort of a stigma attached to it. Hopefully, as we continue to talk about it and get people to be aware, I think it's okay. But it's important that definitely school teachers, school headmistress needs to know. If there is a school nurse, they need to be taught about how to identify symptoms of low blood sugar, how to give insulin, what is the emergency protocol for sugars. But teachers also need to be sensitized, particularly the class teacher. It's very, very important. Yes.
Yeah. So there are, in fact, just adding on to Dr. Jayashree, there are a lot of rights which are additional benefits which are given to children who have diabetes, especially type 1. And recently, now since board exams are going on, so even CBSE has allowed some special benefits for children who have diabetes. So they are allowed a little bit of more time. They can carry some food as well. So be aware about these benefits or rights as well of your to make him more safer. Ma'am, some of the questions as well which are on the chat, and it specifically, they're hinting towards people who have chronic kidney disease. Now, is there a special guidance to them since there are fluid restrictions? So, can they take simply glucose, uh, or what is the guidance to patients largely with people who have chronic kidney disease to
Yeah.
manage hypoglycemia?
Like I said, people with CKD are more prone to low sugars. First of all, make sure that the medicines that the doctor is giving you are in the safe category. There are some medicines which are very safe, which have a very low chance of causing a low sugar. People with CKD can take oral glucose. There's not a major problem with that. You're just going to add to about say 50 ml or 100 ml of water and drink, if at all. IV glucose in the hospital, we tend to use concentrated glucose because we cannot use the regular glucose since, as somebody has mentioned, fluid restrictions will be there. So we are very sort of aware of that fact, and we use concentrated form of glucose that is in the intravenous route. That oral glucose, yes, people with CKD with kidney problems can certainly take oral glucose.
All right. Uh, okay. So thank you. I must thank you here. I think the time has really flown. The last 30 minutes. We are moving towards the conclusion of this discussion now. But in the end, is there anything, ma'am, more important about this subject of managing or identifying low blood sugar, which you still want to highlight, or you like to summarize some of the important points which we have discussed today?
Yeah, I think very quickly, I just wanted to reiterate that low blood sugars, uh, the way I think about it is low blood sugar is more dangerous in the immediate. High blood sugar is something that's going to cause problems in the long term. So you need to have high blood sugars for a long time for it to cause a problem, whereas a single episode of a low blood sugar can cause a problem. So, like I said, everything in your body is in a balance. Even when your sugars, even when you're fasting sugar. So generally, when we ask people to monitor their sugars at home, we tell them check your fasting. Let the range be 100 to 130. If the sugars start going below 100 itself, let your doctor know. Particularly, there may be some medicines that the doctor will need to change. So be aware of what a low sugar is. What are the symptoms? Uh, be aware also that regular monitoring helps to prevent an episode of low sugar, and that we can alter certain medicines to reduce the chances of a low sugar, the situations in which a low sugar may occur, and how to recognize, how to treat, and how to prevent it from happening, which is the most important thing.
All right. So thank you so very much, Dr. Jayashree. And I must thank all my viewers as well who have been watching us live or who may be watching this program later on as well. If you have anyone in your friend circle or in your family who has diabetes, uh, he may be at the risk of low blood sugars as well. So you can simply share the link of this program with them. And this discussion and guidance by Dr. Jayashree Gopal can be very, very useful for them. Our objective is purely to keep you more aware, keep on sharing the information related to diabetes and its associated issues which you can have, so that you can manage your disease or your problem in a more effective way, and really partner with your doctor to get better outcomes as well. So on this note, I'll thank you all. Dr. Jayashree, I'll thank you as well for being here. If you have diabetes, anyone, or you want more information on this, you can always go and meet Dr. Jayashree. She is in Chennai if you are nearby. Otherwise, if you are in some other city and if you face symptoms which are shared by her, please do visit your doctor without wasting any time, and don't ignore this situation. Good night and take care, everyone. Bye bye. Thank you, ma'am.
Thank you. Good night and bye bye.